Ever get a cut that just won't quit? Like it's red and angry and oozing all kinds of nasty stuff?
Yeah, those are never fun. Sounds like an infection brewing.
Exactly. And that's precisely what we're diving into today, a deep dive into how those microscopic culprits get identified. We've got a fictional case study from the OpenStax microbiology textbook.
Oh, OpenStack's a classic. Love that textbook.
Full link down in the description for all you microbe enthusiasts out there.
Always got to give credit where credit is due.
Absolutely. So our case study follows Sam, a college freshman, just trying to look sharp for that first week of classes.
The age-old struggle. Shaving can be a real hazard sometimes.
It really can. So picture this. Sam nicks himself while shaving. Doesn't think much of it at first.
Happens to the best of us.
Right. But then a couple of days later, that little nick turns into a full-blown nightmare. Red, warm, and oozing pus.
Classic signs of a bacterial infection for sure. Those white blood cells are waging war down there.
Yeah, it's a microscopic battleground. So Sam, understandably, heads to the university clinic, and the doctor swabs the wound to send it off to the lab. But of course, it's Friday afternoon.
Ah, the dreaded Friday lab drop-off. Those results won't be back till Monday.
Exactly. So Sam's stuck with a topical antibiotic, some stern instructions to keep that wound clean, and a whole lot of worry.
Well, that's the standard protocol. Better safe than sorry, especially with the potential bacterial infection.
Makes sense. But here's what I always wonder, while Sam's waiting, what's happening in that lab? How do they actually figure out what kind of bacteria is causing all this trouble?
It's pretty fascinating. It's like a whole detective story unfolding under the microscope.
Okay, I'm intrigued. Tell me more.
Well, first things first, they'll look at the usual suspects. The textbook mentions Staphylococcus and Streptococcus as pretty common culprits for skin infections.
Right, I've heard of those. But how do they tell them apart? Are they looking for something specific?
Oh, absolutely. It all starts with microscopy. They'll take a peek at the bacteria's shape and arrangement under the microscope. You see, Staphylococcus, it tends to cluster together like a bunch of grapes.
Oh, I can picture that. Like little tiny grapes.
Exactly. While Streptococcus, on the other hand, forms chains, more like a string of tiny pearls.
Okay, so the arrangement matters. But I'm guessing it goes beyond just what they look like, right?
You got it. There's a whole arsenal of tests they can use. They might observe how the bacteria grow on different agar plates, those petri dishes with the colorful gels.
Oh yeah, I've seen those in pictures.
Well, some bacteria are picky eaters, thrive on only specific types of agar. Others are less discerning, happy to grow almost anywhere. That can be a clue.
Interesting. So they're looking at their dietary preferences, basically.
In a way, yeah. And then there are biochemical tests that analyze their enzyme activity. It's like uncovering their unique bacterial fingerprint.
A bacterial fingerprint. That sounds pretty high-tech.
It is. But that's the level of detail needed to fight these microscopic foes.
Wow. It's like a whole forensic investigation going on for one tiny cut. Okay, so back to Sam. The weekend rolls around, he's not feeling any better, and finally those lab results come in. And guess what?
Let me guess, it wasn't just one type of bacteria.
You're reading my mind. Turns out they found both Staphylococcus and Streptococcus in that wound. Talk about a double whammy.
Oh, that complicates things, but also makes it more interesting.
It definitely does. So what happens when they find more than one suspect? Does that make identification even harder?
It does, but this is where those specific identification techniques come in handy. The textbook specifically mentioned a test called passive agglutination. It's used to confirm Staphylococcus aureus. You might know it as S. aureus.
S. aureus. Yeah, I've heard of that one. Isn't that one pretty common?
It is, and sometimes it can be a bit of a troublemaker. But anyway, this passive agglutination test uses these tiny latex beads that are coated with antibodies specifically designed to latch onto S. aureus.
Antibodies, so it's like a targeted attack.
Exactly. And if S. aureus is present in the sample, those beads will clump together. It's like a microscopic aha moment.
That is so cool. So they're basically using the bacteria's own unique characteristics to identify them, not just their shape.
Exactly. They used a similar strategy to pinpoint the Streptococcus pyogenes, tested its susceptibility to the antibiotic besatracin, and also used another specific latex agglutination test.
Okay, so they got the bad guys cornered. But now I think we need to talk about a really important issue that this case brings up: antibiotic resistance.
Absolutely. It's a huge concern, and this case is a perfect example of why.
Right, so the doctor, being a savvy medical professional, ordered an antimicrobial susceptibility test, or AST, along with those identification tests.
Always a good move, especially when you're dealing with a potential infection.
So I'm thinking of the AST as like checking which weapons work best against the enemy. Is that a fair analogy?
That's a great way to put it, because that's essentially what they're doing. They're testing different antibiotics to see which ones can effectively kill or inhibit the growth of the bacteria.
And why is this so important? I mean, can't they just use a broad-spectrum antibiotic and call it a day?
Well, that's where antibiotic resistance comes in. Overusing or misusing antibiotics can lead to the survival and multiplication of bacteria that are resistant to those drugs. It's kind of like natural selection, but on a microscopic level.
So the toughest bacteria survive and then pass on their resistance genes to their offspring.
Precisely. It creates a whole new generation of superbugs that are harder to treat. And Staphylococcus aureus, that's one of those bacteria that's notorious for developing resistance.
That's S. aureus again, right? The one they found in Sam's wound.
That's the one. So in Sam's case, the AST results showed that the Streptococcus was still susceptible to the common antibiotics. But the Staphylococcus, well, it was resistant to several of them.
Ugh, that's not good. But thankfully, the test did identify a couple of antibiotics that were effective, right? Cefoxitin and oxacillin, if I remember correctly.
Yes, those were the winning weapons in Sam's case. And the good news is, once he started on the right antibiotics, his infection cleared up pretty quickly within a week.
That's a relief. But this whole scenario, even though it's fictional, it really underscores the seriousness of antibiotic resistance. It's a real problem, and it's not just about one little cut.
Exactly. It's a global health threat. I mean, think about it. If we reach a point where our current antibiotics are no longer effective against these superbugs, we're going to be in a lot of trouble.
It's a scary thought. So what can we do about it? I mean, how do we fight back against this microscopic enemy?
Well, it's a multifaceted challenge, but I think one of the most important things we can do is to be more mindful of how we use antibiotics. Only take them when they're absolutely necessary, and always follow your doctor's instructions.
So no skipping doses or stopping early just because you feel better.
Exactly. Because that can actually contribute to the development of resistance. And, of course, preventing infections in the first place is crucial. Proper wound care, good hygiene practices, those go a long way in reducing the risk of infection.
Makes sense. Washing our hands, keeping cuts clean, the simple things, really.
Absolutely. And it's not just about personal responsibility either. It's a shared responsibility. Healthcare providers need to prescribe antibiotics judiciously, and researchers are working hard to develop new antibiotics and alternative therapies to combat resistant bacteria.
It's a team effort. It's amazing how something as seemingly small as a shaving nick can lead to such a complex and important discussion.
It really is. It just goes to show you that the microbial world, even though it's invisible to the naked eye, has a huge impact on our lives.
Absolutely. And that's why we need to pay attention, be informed, and do our part to keep those superbugs at bay. So for all you listeners out there, next time you get a cut, take care of it. You never know what kind of microbial mystery might be lurking beneath the surface.
Words of wisdom. Stay vigilant, stay informed, and stay healthy.